The importance to have an annual health check is that if any time that you feel better, but then something can occur that you don't know that's there, and they can find it before it's too late.
It's known that people with learning disabilities have poorer health than other people in England. A lot of that is due to their learning disability, their communication problems, not accessing services. Annual health checks are invaluable for improving health for people with learning disabilities.
This is my action book, what Jean gave me for the second one. This is really good. I used to go and get support with my dentist, but now I go on my own. And then get the bus home, and then get the appointment and write in my diary. And I go to the doctors, the GP, and I got treatment for my feet as well.
A positive experience when I went to GP once was when I went there for, like, I was really anorexic. I was like 7 stone, and I really wanted to gain weight, but I weren't gaining it. And I went to the GP, and she spoke to me just like really nice and like in a friendly way, instead of just like, oh yeah, you're just another patient. Yeah, I don't really. They proper care for you, and like she was like explaining, do this, try do that. And then when my mum was like, oh, protein shakes, are they meant to like work and everything? She's like, yeah, that's fine, but don't worry about it that much. Just try and eat a bit more. And I was really happy, and I did gain weight. I'm 9 stone now.
Every year I can go see my GP, and he knows that I will be there, and I will be able to. I can tell him what their problems are, if there is anything, and he can help me, and he can help Mum.
The first one, when I went with a community nurse, they did my blood pressure, they did my blood tests, checked my ears, my eyes, and that.
They'll weigh me and they'll blow those things up and make sure if my ears are right and my eyes.
He asked me how I'm getting on, what could he do, if there's any paperwork he needs to sign. So the last one I went to, he signed on about me getting a personal trainer, which I'm going to start on Thursday.
I recently supported a lady in for her annual health check because she wanted me to go with her. Some people will go on their own, some people will go with carers, some people go paid carers, some people go with parents, some people, like this particular lady, wanted me to go with her. I didn't say a lot, but during the annual health check, it came about that, well, the nurse first said, I haven't seen you in a long time, and she said no, she didn't really want to go to the doctors. After the annual health check, well, the outcome was she was prescribed 2 topical creams for different skin conditions. She had antibiotics and steroids because she had a chest infection, and she had a referral to neurology. This wouldn't have ever happened if she hadn't had an annual health check. She would have just carried on the way she was going. So it is invaluable.
Many parents that I spoke to felt that the Learning Disability Health Check was a really positive opportunity for their child. However, they did express concerns and anxieties when they visit the GP surgery, especially around waiting times, having to tell their story over and over again that their child has a specific diagnosis. Many parents saying they're being judged for their child's behaviour because they're not used to the environment and it's not quite suitable for their child's needs. The young people, on the other hand, actually quite enjoyed going to the GP surgeries at times. They found that the GPs, the practice nurses, were really helpful. They'd like them to smile when they walked in the door, but they went there when they really needed help. So they recognised that the GP surgery was a really important part of their health.
One of the main things they can do is just be welcoming, and a happy smile will make all the difference to an adult with learning disabilities. Obviously, flexible appointment times. If somebody's got anxiety, offering them an appointment at the end of the day when it's quieter, offering quiet rooms, using signage, photographs, maybe even having an open day just to let them get familiar with the surgery and the staff. And one of the main things is just treat people like you'd like to be treated like yourself, and be welcoming, smile, and be patient.
When I had to get my stitches out for a surgery that happened 2 weeks ago, last week Wednesday, I was meant to get 2 stitches out, and we were sitting there, and literally half an hour went by, and then the person who came in after us, they went in, and then we was like, what? And then another lady that came in after us went in, we were just like, and then I was just getting really angry, and also where I'm autistic, it does really make me angry, but I was just trying to focus on my phone and calm down. And then when we did get called, she was lovely, knew what she was doing, and it was brilliant.
We went to the hospital in Basildon, and we either found out any questions. I'm a bit nervous, right? And then I asked him again, so I said, okay, it showed me the picture of my bones, and I was so petrified. I walk out. I mean, it's not my fault really. I got help by Jean. So, and then the other day I come back again, and then I take it, and then I have it done. And I didn't know what happened. I just dosed me off. And then I got a little bit of support with my brother. It's my twin.
Hello, my name's Sharon, and I have a 13-year-old young man who has additional needs. His name is James, and our kind of experiences over the past few years of going to the GP surgery have not been wholly successful, sometimes due to the lack of understanding of the actual receptionist. Maybe having a smile when we walk into the surgery might be quite nice. The actual GP having some empathy towards the young person. We also have a pain indication chart that we take with us to the GP surgery for James to be able to explain, because he's non-verbal, how and where it hurts him and how much it hurts him. We do have some very positive experiences in other places that we go. The Royal London Hospital, where James is under the dental unit, are very, very aware of his needs and are very, very accommodating when it comes to a quiet area, somewhere for him to relax before he actually has to see the dentist. Other than that, I think my problems coming forward for James is that because he is non-verbal, people being able to understand his needs and being able to understand how he feels about going to all these different appointments.
When my son was coming up to 16, we had some information come in about the disability healthcare checkups, and which I thought would be really, really good for him because he's autistic. When we go to the GP, he hasn't got that verbal to explain what's wrong with him. So I asked the GP and he said he couldn't. The paediatrician had to. I spoke to the paediatrician secretary. They said no, a psychiatrist has got to do it. The psychiatrist said no, a social worker had to do it. And then that's as far as I've got really. No, basically, because when he was diagnosed with autism, because the words learning disability didn't appear as a diagnosis, they won't see him, but his problems are the same. He's got a good understanding now, but when it comes to understanding health and things like that, he hasn't got it to understand, and he would need me all the time with him to explain. So in my opinion, he would need that one checkup a year could tell me as a parent, and for him, if anything's wrong or anything's going on the wrong side, because he doesn't explain pain either.
I get panicky because of my autism, so it would help for GPs to understand some patients might want to know when their time is ready, because I know the GPs are running late, even though in the morning, when it's like the first appointment, they're always running late. But it's not only your health and well-being, it's your family's health and well-being. So if you're not well, then your family can't look after you, and so on and so forth.